Part 4 is all about SBAR communications, and I'm not going to spend a lot of time on this because we use SBAR all the time, but I do want to make sure we still thoroughly understand how this works. So SBAR communication, why do we use SBAR? Situation, background, assessment, and recommendation or request. Now, we use SBAR in healthcare handoffs between nurse and physician, nurse to nurse, or nurse to home health aide. We use SBAR communication because we want to make sure we answer all the questions up front. We want to eliminate poor communication. We want to eliminate incomplete communication. It does require some training to use properly and some practice. But this is a standardized approach that promotes efficient transfer of key information. And it helps create an environment that allows clinicians to express their concerns. So it's used as an error, hopefully it has an error-free handoff. It communicates interactively, it allows and promotes questions. It communicates up-to-date information regarding care, treatments, services, and conditions, but can compare it to what happened in the past, so you see the before and after. It limits interruptions because it's logical. You should make sure you allow sufficient time for a proper handoff. There needs to be a verification process. You want either a readback or an interpretation, them to give their interpretation of what you said. So why do we use it? Basically, make sure that we answer the three most important questions. What's the problem? What do you need to do about it? And when does it have to happen? So the SBAR, the situation, the S, make sure you have all your information in front of you before you even start the conversation. That may mean you may need to write a script out if you're new to calling doctors. Make sure you have your name, the age, diagnosis, because you may be calling a doctor who is not the primary doctor of this patient. Know the allergies, know the vital signs, know your vital signs. It is so embarrassing to call a doctor and not have all the vital signs that you took. You're not going to use vital signs that your CNA or another nurse took, unless the other nurse just took them. If a CNA comes to you and reports that you have a patient with a blood pressure of 180/100, you are not going to call the doctor based on that blood pressure. You are going to check it yourself. So get current vital signs. Make sure you have current lab results. And know the important labs. So when you call the doctor, you're going to tell them about what you have seen, not what somebody else tells you about. You physically need to be there and assess the patient before you call. Review the chart for appropriate physician to call and make sure that you don't have the answer already in front of you. It is possible that you're calling for something and you have an order that has already been written to address that problem. Suppose the person all of a sudden has a respiratory rate of 42 and their SATs are 88. You want to call for an order for respiratory therapy or increased oxygen. You may have that order already. This is a great way of irritating a doctor by calling them needlessly. When you call, identify yourself, the hospital, and the patient's name. Give the situation of what's going on. Patient Joe has a blood pressure too high, or their respiratory rate is too low, or whatever. Give the situation. Why are you calling? Give the background. What brought them to the hospital? Make this concise, but give the key information. So what brought them to the hospital? What were their vital signs in the past? If you have a blood pressure 180/100, what was their vital signs earlier so they can see the comparison? If you have a lab value that's out of whack, what were the labs before so they can see the comparison? Give the assessment. Share the results of your clinical assessment, your vital signs, your current labs, your observations of the patient. And then request, the R. Many people want to do recommendation, and when you are a seasoned nurse, you probably can do a recommendation, especially if you know the doctor. If you don't know the doctor and you're not an experienced nurse, I hesitate on suggesting that you recommend anything. Ideally, what you would do is you'd end your SBAR report with, what should we do about the blood pressure, respiratory rate, hemoglobin level, whatever. What should we do about the? Ask specifically what the problem is. Make sure you call the correct physician too, by the way. It's very embarrassing, again, to call the primary care physician when you should have called the surgeon. So, as a summary, you want to use SBAR Communication whenever possible because it provides clear and uniform approach. You will always cover the information correctly when you use SBAR Communication. It does empower all members of the healthcare because it allows input. And as you use this format, it becomes very easy and very comfortable. SBAR Communication. It's the required method of reporting when you talk to doctors and other nurses. Come back for the 5th and final section of this learning plan.